And to refer to the JAMA psychiatry study, I mentioned the statistic of percentage of people that progress to it. But if we're looking at the risk ratio of a cannabis-induced psychosis and schizophrenia, I think it was 240-fold. You don't see numbers like that for many other data sets. And of course, there's confounders that we try to control for that aren't fully accounted for. The same things you would say for any other observational research. But when you see numbers like that, that is pretty alarming.
So what are the what do the red flags look like of somebody who might be on the precipice of, I guess, a schizophrenic break, but also can you observe somebody and say this person is going down that road, they should stop? You know what I mean? Like symptoms or red flags that you're using too much cannabis or too high potency of cannabis. What does that look like? Yeah, if you're a concerned friend or family member, what should you look for?
So I think even before the onset of symptoms, you look for static things like family history. If there's a family history of schizophrenia, the closer, the higher the risk. So if it's a parent, higher risk than if it's a grandparent. You also look for demographic variables. So we know that young males, independent of cannabis use, are already at a much higher risk of developing schizophrenia at a younger age. So that's something. With the cannabis use before symptoms, as I mentioned, higher THC content, daily use are very strongly associated with developing psychosis, but also schizophrenia. And then the other things from a clinical setting is if you're seeing someone using cannabis, fitting the definition of what I described before of a cannabis use disorder, that's more of a high risk. But if you're starting to see functional impairments as well too, say it's an adolescent that's in school or university, something like that, and they're not going to school, they're performing worse, they're losing their friend groups. Obviously, there's other variables that can cause this, but this can speak to a level of functional impairment. If there's elements of psychosis that are coming out, so someone now has a very big obsession with philosophy or something, and this can be normal too. I like to read about things like that, but if it's out of the blue and just seems out of character for the person, can also be early signs. So there's a lot of different signs that someone may be experiencing changes from the cannabis or psychosis, and it's very important that these are recognized earlier on and caught to address things rather than allowing the symptom progression to progress to the point of developing a chronic mental disorder that needs lifelong treatment.